But before we get started, I do want to have a new team member introduced. So Matt, I'm going to turn it over to you to introduce our new volunteer manager.
Yeah, good morning, everyone. Thanks for popping in for our conversations over coffee. We always have such great conversations. I did just want to take a minute to highlight. Can you all still hear me?
Yeah.
I got a okay. I got a message that I was signed out, but I still see things, so I just wanted to check in and make sure. So Tessa Evers is joining us on the community engagement team. Tessa is our volunteer manager. I know that a lot of you have volunteered with us in the past or are maybe interested in volunteering with us in the future. So we just wanted to get you connected with Tessa here. Tessa's been with us for just over a month now. She comes to us with a background from St. Norbert College, where she studied business administration and theology, religious studies. She also has experience working with people experiencing homelessness out in Colorado as a street outreach case manager and in crisis housing. So certainly she'll do well here at Pillars. And she also has some local experience with volunteer management at another nonprofit. So happy to have you joining us, Tessa. Anything you want to add in there?
Hi, everyone. Good morning. Thanks, Matt. Yeah, it's just been such a great time here at Pillars, even though it's been short. I'm so excited to be here. I'm so excited to meet everyone. And I've loved working with the volunteers so far. If you have any questions, please reach out. I will put my email in the chat.
Thanks, Tessa.
All right, thank you, Tessa, and welcome. We're so happy to have you on our team. It's been a joy to work with you this month. So let's move into our topic for today. We're going to discuss the connection and the experience of veterans who experience homelessness. As many of you on this call probably have heard, we do have, or there is a higher likelihood of veterans to experience homelessness versus the general population. So let's start out by taking a look at a few numbers. So this is some data, national data. It's from the PIT count. So I'm getting a little bit of an echo. Is anyone else hearing an echo? All right, now it went away. So it's from the PIT count. Many of you guys do know what the PIT count is. It stands for point in time. And this is part of a national effort where people around the country go out on the same night. We do it here in the Fox Valley as well. We've mentioned it in previous conversations over coffee, and we look for people who are unsheltered. So just trying to get a snapshot in time, what's happening on that day? Like how many people can we find that are experiencing homelessness on that day? So this is the national data from VA.gov in terms of the January 2023 PIT count. About 35,574 veterans that they found experiencing homelessness. Of those, about 20,000 were experiencing sheltered homelessness. So those would be the people who are in a designated shelter or transitional housing, something like that. About 15,500 experiencing unsheltered homelessness on that night. Those would be the people who are living in a place or spending that night in a place that's not meant for human habitation. So the people who are outside or sleeping in their car, in the parking ramps, things like that are considered unsheltered. And overall, since 2010, we've actually seen a downward trend in veterans homelessness by about 52%. But then this time, like just from January 22 to January 23, we did have a 7.4% increase or jump in the numbers. So a little bit of national data. 1 second here. We just got our case manager who's joining us today having some technical issues, so he's gonna jump in on somebody else's call. Sorry about that. So in terms of Pillars data, we served in our fiscal year 23, which run from October of 22 to September of 23. Out of the 1,346 individuals we tracked in our data management system. 39 of them were listed as veterans. That was out of 39 households. So essentially that means that every household had exactly one veteran. There was no two veteran households. Of those, it was predominantly male veterans. We did have two female veterans. And if you look at the chart, most of them were individuals. So not households that had children, but coming in as individuals. We did, however, have 8 households that did have children. Another thing that you can look at on this chart is you can see that most of the individuals we served were not chronically homeless. So what does chronically homeless mean? This is defined by HUD, and it's people who experience homelessness for longer than 1 year or 4 or more episodes of homelessness within the past 3 years that collectively add up to 12 months combined. So those are the people who are experiencing homelessness for a longer period of time. The non-chronic homelessness, it's a pretty new first-time experience for them. You see that those numbers show that about 3/4 of the people that we served were newer to homelessness. We're not chronically homeless. In terms of veterans by age group, interesting. Most of them are a little bit older. So 55 plus was over half of the veterans that we served. Although we did have some that were younger as well. You can see the age breakout here. Just to give it a little bit of context, because sometimes years are a little bit difficult for me, especially this early in the morning. This data that I pulled is from a census taken in 2018. So they're probably, a little bit different now, a couple years older, since a few years have passed. But the median age of all veterans at that time was 65. For those that served post 9/11, the median age was 37. So they'd be in that light blue 20% category. The largest number of veterans nationwide was our Vietnam era vets. They had a median age of 71 at that point. So they'd be in that larger section over there. So another interesting data point that I pulled from that census report was that the post 9/11 vets were more likely to have a service-connected disability, which is defined as an injury, disease, or disability that active duty caused or aggravated. So a few data points there for you guys in terms of what Pillars is serving. Where do we get these data points from? These would be clients that were served anywhere in our programs that use the HMIS data management system. So that would be our prevention programs, our crisis programs, so street outreach, our 2 shelters or the resource center, as well as our supportive housing programs. So they're housed with us, they get case management through us. It would not include our stable housing or market rate housing. There is the possibility that we do have veterans who are being served by us as one of our tenants, but we not track them with the same system, so they would not be included in the data I just shared. And then I do also just want to point out we have one veteran-specific program here at Pillars. We have 6 of our housing units out of, I believe, 140 total that are set aside for veterans and their families. These are meant for veterans that have a diagnosed or self-identified disability. And they do need to have some income. Rent is going to be set at 30% of their income. So they do have a little bit of rental assistance as needed. And then they also receive case management to support any financial, physical, or mental stability goals that they need. The individual goal or the goals are determined by their case manager working with them just to see, what you need to get more stability. This is not a time limited program, which means they can stay until they are ready to leave. It's not limited to 1 year or 2 years or anything like that. All right, so I'm going to stop sharing right now. All right. Hi, I can see all your faces again. Good morning, everyone. It's my first time seeing. And now I'm going to ask some questions, open the floor. But before we get started, I'd like to have the people who agreed to be a central part of answering those questions, just introduce themselves briefly. Again, if you have an answer please feel free to share that answer at any point. But let's see, Bill, did we get you on? All right. I don't know who Bill went on with. He's with you? All right. Can you unmute so that Bill can tell us? Bill, can you just tell us a little bit about yourself? Bill is one of our case managers here at Pillars, but how long have you worked with Pillars with people experiencing homelessness and specifically with veterans?
Good morning. I'm Bill. I have been with Pillars for almost 8 years. I worked in shelter for 3 of those 8 years, and I've been a case manager ever since. I've worked with different types of veterans in shelter and in some of the programs. So hopefully I can give you guys an idea of kind of the people that we're seeing and what we're doing, to help them.
Thank you, Bill. And then we have John on the call for us. John works with the Fox Valley Veterans Council. So same question, John, can you just give us a brief introduction? How long and what capacities have you been working with veterans?
Good morning, everyone. Jonathan Polipiv. I'm the Community Engagement Manager for the Fox Valley Veterans Council. And we have the Veterans Emergency Fund in the Fox cities since 2011, and we've been doing that. So I started with the Fox Valley Veterans Council about 1.5 years, and then involved previously in different roles and capacities with student veterans or in the community, and as a veteran myself through different veteran groups I've been a part of.
And then we have David and Kelly, right?
Yep.
Who work for Outagamie County. Can you tell us a little bit of the same thing, brief introduction?
Sure. David Holst, Outagamie County Veteran Service Officer. I've been in the veterans benefits arena for a little over 10 years, and I just love the job because it doesn't seem like work. So, Cal?
Cal Bales, served 23 years in the Air Force, joined the team back in November last year. Kind of same sentiment, just phenomenal opportunity to help veterans, and we get paid to do it. So it's it's incredible. So
it's always nice to be paid for doing something that doesn't feel like work, isn't it?
Yeah.
So let's start. Well, first question I have for you guys is often when I see portrayals of veterans experiencing homelessness in the media, they're a very specific subset. It's people who have been living unsheltered for years, typically wearing the multiple layers of clothes, look like they could use a little bit of time spending on their personal hygiene or at the laundromat. That image of homelessness. But when I look at the data, that's not the actual case. Again, we just saw about 3/4 of the veterans that we served last year were experiencing homelessness for the first time. They were not considered chronically homeless. So even though there are chronically homeless veterans who do probably look like that, it's not the reality for the majority of veterans who are either experiencing homelessness or are at high risk for becoming homeless. Are there any other common misconceptions that you guys have about your agency, about your services, about the clients that you serve? Or is something that you wish people would understand about veterans who are high risk or experiencing homelessness?
I guess I don't know who you would like to go first. I can go unless Dave and Kelly want to go.
John, go ahead. You're good.
Yeah, so I think that's some of the misconceptions we see. Veterans portrayed a certain way, but we also see other members of the community portrayed in sometimes negative stereotypes. The reality is, veterans, just like any person in the community, there's a whole segment of the population, and sometimes people are experiencing homelessness just for the one time because maybe they had a major life change, maybe they just had lost a job, a reoccurring injury from their time in service. That's what we end up seeing a lot of times. Sometimes people just need help for one-time assistance. It just to get through that challenge or adversity they're going through. And sometimes if they don't know what resources there are available, they might actually experience homelessness, and then they connect with those resources after that. So so that's why we strive to intervene before that happens, before people experience homelessness. But unfortunately, the stereotypes do get amplified. Sometimes that feeds that stigma, that veterans that are maybe wounded or have visible or invisible wounds. And unfortunately, those are stereotypes that aren't accurate for majority of veterans. But just like veterans too, it happens to other people in the community too.
David?
Well, I guess the biggest misconception that we experience here at the Outagamie County Veteran Service Office, a lot of people think we're the Veterans Administration, also known as the VA. Well, we're not the VA. The VA is federal and we're county. We receive no federal money in this office whatsoever. The only money we do get is a small grant from the state. And this year we got like $17,000. It costs around $500,000 a year to run this office. So guess who picks up the difference? The county taxpayers do. So actually, everybody on this conference call is my boss, and I'm working for you. So that's the misconception. We are accredited with the VA. We work with the VA, but we don't work for them. We work with them.
I'd like to piggyback what Jonathan said too, is that oftentimes we forget that the veterans represent a cross-section of population. I saw this in the training world as the students were transitioning from basic training into the technical training. That's where you start to kind of, some of the issues start rising to the surface of personalities, culture, things that they quite haven't gotten beaten out of them at basic training. I'm just joking, but you know what I mean, is that again, they bring into the military things from the past. So I know that, for instance, a lot of the veterans that are clamoring for benefits are the ones that perhaps served 90 days or less, or a month. They're still veterans. We still want to help them. Absolutely going to help them. But there's a trend there that perhaps maybe there were poor life decisions even prior to the military. They've now done the military, and then now they're exasperated post-military. That's not the rule per se, but I have seen that, again, where there are those cross sections of the military personnel. But again, like Jonathan said, there are those that have that one-off, a divorce, or made a poor decision at one point, where just trying to get back on their feet.
I'd like to add one thing, because what David said too is, sometimes people think that the Fox Valley Veterans Council is the VA, or what we hear often, and our case manager Rick will say that people will see us, they're like, "Oh, you're with the veterans," so that there's this perception that yes, we are with the veterans, but we're not with the federal VA. We work with federal VA employees and some great folks that do, and really part of this connection in the community that helps the veterans that are struggling or thrive. But yeah, we are different entities. We're a nonprofit 501c3, but we love our collaborative partners through all segments of federal, local, and state governments, including private entities and other nonprofits such as Pillars.
All right, thank you. So another question I have is that, again, evidence shows that veterans are at greater risk of experiencing homelessness than the general U.S. population. They're not the only group that has that, like subgroup, but they are definitely one of them that is at greater risk. So I'd like to dig into that a little bit more. What are some common barriers and risk factors that you have seen with the veterans that you've worked with? And I know you guys just mentioned a few, but if you want to elaborate on what you said before, are there any unique challenges that you think are faced by veterans that might not be faced by the civilian population experiencing homelessness? Are there any common challenges you think that are just common to people experiencing homelessness across the board, veteran and civilian alike?
So if I could,
So do we want to start with?
yeah, I'll
let's start
start real quick. Veterans are very reluctant to talk about their service by and large. I think you see that a little bit more. And I know that as gracious as veterans are, as we are for the civilian, there's almost like this, everyone now is saying thanks, veterans, and doing this. So there's like this reluctance where it's like, oh, hey, where the Vietnam veterans came back, we're not welcome, we're spat upon, we're treated like garbage, and now we're just now recognizing them over the last 20 years or so. The GWAT veterans are coming home, and now everyone is throwing a parade for them, everyone's offering these things, and there's kind of this saturation where they are grateful to be able to get the discounts and things, but at the same time, like, boy, I'm really kind of reluctant to talk about my story. So that's one issue. The other issue, again, is the mental health piece, that where people are significantly changed by the military, myself included. There's all sorts of, and Jonathan and David and any veteran could testify, it's a very, very different world. And there are a lot of intangibles, things that we experience as veterans that the average person would not experience, and or accelerated. For instance, I heard from a former commander saying that those who deploy to a war zone will age twice as fast. So there are those type of things that maybe my mind is 50 years old, but my body feels 80. So, but again, the veterans typically are not going to talk about that unless prompted. They're going to be very close hold with a lot of that information. Very difficult to get those stories out of them.
David, or you can have something to add?
No, go ahead, John.
Okay. I think, yeah, I echo really what Kelly said. There's a lot of, that, and I personally have experienced that. And I think some of the challenges too is, you have different cultures within the military, different branch. Now there's the Space Force. I was in the Army, but I was also in an Army National Guard as my unit. And then we deployed, it says Army on the uniform. And we were doing the missions in Iraq. That's what our missions was, convoys. So like even in that culture, like we have different people, different bases. They were doing slightly different jobs, different roles. So we might have been serving the exact same area, region, but doing totally different things. So that's not, it's relatable, but it's not exactly the same. So all of our experiences are different, and we hear about different generations. And today is the 80th anniversary of D-Day. So, that generation is known as the greatest generation. That's a great sentiment. It is true, because the sacrifice, the men and women who served our nation then and continue was incredible, to liberate Europe and free so many people. And but then you follow the patterns after the different wars, and that attention was changed and it was different. Involvements, in Korea, a lot of people forget about that war. And then there's Vietnam, and totally different experience. So people are less reluctant maybe to say, hey, I'm a veteran. At least this is what I hear from a lot of Vietnam veterans. They burned their uniform when they came home in the airport because they were mistreated, spit upon, called a lot of derogatory names. So they were less, they were more reluctant to ask for help or to seek support for the things that were, no fault of their own, but just because of the exposure to maybe Agent Orange or other toxic things, they just didn't seek it because they didn't think they were valued in their service. So I think our country has done, much better job of trying to rectify that and make it better for like my generation of veterans, that it's okay to seek help. It's okay to seek assistance for those benefits or entitlements that us and our family have earned. So we shouldn't have to struggle in getting through with our health issues or other things, or the wear and tear. Like Kelly said, I mean, I personally today, like I feel it in my back. If you look at me, I'm 40 years old. I don't look that old. Maybe my beard ages me a little bit, but it's the fact is, like, me and others, we might have spent a year in Iraq driving around in Humvees. Just that wear and tear on your body from the service, jumping out of planes or whatever kind of job someone had, it's a wear and tear. So that in itself, but veterans, I think a lot of our peers were very resourceful too. We learned in the military to be resourceful. We learned how to camp. We call it training, right, in the rain. And so we learn how to survive in all sorts of environments. So I think some veterans, they don't necessarily even identify as being homeless when in fact they are. And sometimes you have to point it out to them. People come to our office, they're like, well, I just need a little help. I'm staying at this campground with my family, our kids going into school, and they need some school supplies, or struggling to pay our, the campground. Otherwise, they're going to kick us out. And they didn't identify as homeless. So we were able to help connect them, one, pay off some of that basic needs, so they could at least stay there, stabilize that, get them connected. But like, that's one example of a family. And then there's so many, because, our biggest strength is, one of our biggest strengths sometimes is that independence and able to serve and help others. We're reluctant to sometimes ask for help ourselves because we think others need it more. And so that servant's heart that's common in veterans and other people that contribute to the society in different ways like that, it's also one of our biggest kryptonites, because we like to serve and less likely to ask for help. So, but
David or Bill, anything to add?
I'll say John was spot on.
Thanks, David.
Have
It looks
you
like we
guys-
have a gentleman with his hand up here.
Sorry, Stephanie, I just would like to
Hi,
add
Jeremy.
something. I'd like to add something too. I'm Jeremy Hansen from Fox Valley Technical College in the Veterans Resource Center, and work with, John, David, Cal, quite often. And, really to mirror what John was saying is the resourcefulness. We see that too, is, somebody's like, well, it's kind of cold tonight. I'm sleeping in my car, but I really need some help with books. We're like, oh, okay, well, let's back up a second here. But other things too is like pridefulness, that, we seem to see quite a bit too, is that the veterans don't think that they think somebody else has it worse. And they're like, we'll save those benefits for somebody else. So really, I think, especially like a forum like here, and collaboration with public and private organizations, to help get the word out and really help communicate that there is enough money for helping every single veteran, and there are a lot of resources, and I think that's, in my opinion, one of the biggest challenges that we have is that I always say, if I become independently wealthy, I'm going to put all those billboards down Highway 41, and they're all going to be different veteran benefits. That would be my wish, for that to happen. At least one. There's nothing out there. So yeah, but again, just to mirror what John and David and Kelly, is that the resourcefulness and the pridefulness, I think, is one of the biggest challenges that our veterans are facing.
Thank you for jumping in, Jeremy. Like I said, I know that there are a lot of professionals on this call who have something to say, and please feel free to unmute and say that. Again, I might not see your hand, but that's what my team members are helping us watch out for, so thank you. So another question. So for the last decade, our data has shown that the percent of homelessness, or of veterans who experienced homelessness, was decreasing. But then suddenly in January 2023, with the PIT count, we had a jump, an increase. So first, to that decrease, have you seen any specific programs, any specific attitude shifts or changes to veteran support over the last decade, or during your time working with veterans, that you feel have contributed to this overall progress towards decreasing homelessness in veterans? And what do you think may have contributed to that recent jump?
I can start off, Stephanie. So one thing, we do know that the VA and the federal government made a goal to eliminate or significantly reduce, ultimately, veteran homelessness. So there's a federal program called the SSVF, but it's a program. So it's facilitated in our region by CVI, and that program was intended to help connect veterans, supportive services for veteran families. That's what it stands for. So that's one example. So there's been a lot more outreach. I think, in my opinion, too, at least in our area, which I feel very blessed that we live in the community we have really great collaboration in our community, because one, I look at like the work we do. We help provide emergency assistance for local veteran families. So it's kind of like I equate in the military, like we learn like basic, combat life-saving skills. So help stop the bleeding, stabilize, and then connect them to the other resource. So like the county veteran office, right? So like Dave and Kelly and their team, they can get them some additional long-term benefits they may be entitled to. And so I think connecting people with like the PACT Act or other entitlements or benefits, and just the change in culture, the less stigma now for asking for help, it's improved. And I think more veterans of my era, from my perspective, seems like more willing to talk about their experiences. Where I talk to a lot of other older veterans that are maybe Vietnam or others, they were less inclined. They're opening up now more, but not as often when they were younger. So I think there's just some cultural changes, the norms that are different now, but also just a huge investments. And then as far as the uptick again, obviously inflation, that's the big, the big I word. No one, we don't want to think it exists, obviously, but it does, and it affects a lot of people. So if someone's on a fixed income, all of a sudden their living expenses, maybe their rent doubles because the landlord has to they have to cover their costs and make money and their goals, but now all of a sudden they don't renew a lease, or maybe they bump it up, right? Like, so that the veteran family that was maybe paying $700, now they're paying $1,400 or more. There's a lot of things like that. So people are stretched more in the resources, and their cost of living is going out, but maybe their income isn't. So those are some of the things I've seen and our organization has seen, and I'm sure the other folks on here can add to that too.
Yeah, and I'll echo that. And I think we've seen that in the like the general population that we are serving here at Pillars. It doesn't matter your background. We have seen that jump in cost of housing being a huge underlying factor with people suddenly struggling with first-time homelessness. They had it under control, and now all of a sudden they don't. So, David, Bill?
I'll say something on this one. I think there's a lot more people coming into the United States than ever before. I know my family came to America back in 1865, so I'm just like everybody else seeking a better opportunity. And when all these people show up, everybody's looking for a place to live. And now, well, there's more people than housing, and now everybody in this conference call can agree that there's a severe shortage of affordable housing. So gosh, we need more housing, and it's gonna take a while for that to get caught up. But I think there's at least in this area here, there's gonna be a big crisis next April when the draft for the NFL comes to Green Bay. And where are they gonna put hundreds of thousands of people? And the NFL has booked up most of the hotel rooms in Green Bay. And they're talking about maybe bringing in cruise ships and putting them in the Bay of Green Bay to help house people. Well, what is that going to do to the people already struggling to find housing? And at least for that 3 or 4 days, housing is going to be nearly impossible to find, because any apartment that may have been rented out at a reduced rate, maybe they're not going to get that opportunity because they can charge 3 or 4 times that. To be frank, that it's going to be bad in about a year. I don't know how we're going to fix that as a community. This is going to be challenging. I know every year EAA comes to town, and the homeless veterans that would normally stay in a hotel are displaced, and then they come in here, so we see it firsthand. I don't know how to fix that, and that's why I'm partnering with everybody I can get my hands on to help me fix this, because I can't do it alone, and that's why I'm glad to have so many community partners to work with. So
I'll be the elephant in the room and call a spade too. There's, we're getting conflicting information from on high, from, the government level, where they're saying, oh, we love our veterans. But then we have open borders. Again, not trying to get political, but it's reality of things that as these illegal immigrants make their way across the borders, again, they're using valuable resources that frankly, the border states, and now as they're being bused or flown to different areas, are now occupying those spaces. So again, it's this massive displacement. So while the government's saying, oh, we love our veterans, we're going to kick up these programs for housing, equally they're taking schools away and putting homeless or putting illegal immigrants into these schools. And that's fine. We need to take care of people. I don't have an issue with that, but it's sending a mixed message right now. And when we're getting calls from our veterans saying, I can't get into the VA clinic, especially all along those border states, that as a veteran, I'm going to the VA clinic. I've been displaced because they've turned those clinics into clinics for the illegal immigrants. So it's just a mixed message that the government on high is sending us. So while we're trying to combat something, and we have great resources to do so, there's now this great influx of people that we were not expecting to be in the area, that we have to still help, but there's finite resources. So how do we do that fairly equitably,
And that's a challenge.
It's a great challenge, so, because again, we don't want, they may be illegal, but we're still human. We still want to make sure that they're housed. But our veteran who equally has a need, so how do you, where's that line if there's finite resources? Who gets that house? Is the veteran or is the family? Well, the family has children. I'm sure that veteran is going to say, you know what, let's give this to this family instead. I'll go ahead and live in my car. That's just the way, that's what the heart of the veteran typically is. So that's going to be an interesting challenge coming up here, as well as we see more and more moving north.
It certainly is a complex issue. I do just want to say, I see that there was a question in the chat from Richard about the PIT data for 2024. I have not seen anything national yet, but I would not also be the first person to see it. So if someone else has, let me know. But it doesn't surprise me that we don't have the 2024 data quite yet, simply because it just takes a long time to process. We do have the local data from 2024, so what happened in the Fox Cities point in time count for January, but I have not seen anything on a national level, nor have I seen if veterans were broken out of that particular one. And to be honest, I didn't ask. So it might be there, I just simply didn't ask for it. So I don't have that right now. If anyone on the call does and wants to jump in, great. Otherwise, that would be something we have to research a little bit to get. I'm sorry that I don't have more. You know how government reporting works. It takes a while.
So I have some of the local data. It's not separated by veterans, but it may or may not look like Shannon's digging. I can see her digging there. Shannon's our data connoisseur. So in January of 2024, our area discovered 37 individuals who are unsheltered that during the PIT count. The data for July obviously won't be here until we conduct the count in July, but the increase in January, the year prior was 24. So 24 to 37 jumped about 52.5%. I don't know how many of those were veterans. Shannon, have you found that at all, or are you still digging? We're digging. Okay. I'm sure Shannon will be able to find it. Yeah, and we'll be able to pop that in the chat for you, Richard, and everyone else, because I'm sure everyone else is probably
I think I
curious.
saw Liz on this call too, who is the official owner of the PIT data. So I'll put her if she wants to dig too.
Yeah, so Liz, if you have anything, you can let us know. But again, the fact that we don't have anything national level, that doesn't surprise me. It takes a while with so many individual areas reporting to compile all that data. So. All right, so another thing that the data shows, just to kind of get back to the services and supports that are available, is that if you look at the total number of clients we serve in the Fox Valley area and how many of them are veterans, it's actually quite low. It was about 3% of the total clients that we tracked using our HMIS system. So I know that we have more than 3% of the Fox Valley being veterans, so it seems that's lower. And that leads me to believe that there's probably something in place, some sort of preventative measures that help reduce the risk of veterans before they become homeless after their service, or programs that are in place before they have to fall onto pillars for help. So what other services are available out there? Now, I know both David and John spoke on, I'll get just a second, Dave, I want to finish my question. I know both David and John spoke about how they are a little bit more hesitant or reluctant or don't even think to seek services. So that probably plays a role as well. But I'm sure there's some amazing services out there, and could you share those with us?
Yeah, I can go. So I mean, one thing I'd like to say. So the pit count. It's a great opportunity, by the way, for anyone to participate in. It's really helps eye opening to connect with people. And so our team, we actually encountered a homeless veteran. He was living under the bridge there on College Avenue. And it was the same individual we saw a couple weeks prior, and we helped him with a hotel for about a week. Right, we try to connect them to other resources in our community, and the reality is, him and some others that we've assisted, their choice is not to pursue those other opportunities, and so that's this decision, right? And for whatever reasons he has, maybe the different barriers or just the choice, the freedom that people have. So I think in our community, especially what I get to see at our organization sees is we do have a really incredible support system for a lot of veterans because like our organization, the Fox Valley Veterans Council, we've existed since 2009. And we started our emergency fund since 2011. We've provided over $1.6 million of emergency assistance to area veteran families in need. And majority of that this year so far is about 75% that's for housing. So someone gets eviction notice, maybe first month's rent they need, or maybe they need to catch up on a couple payments. So we oftentimes can cover that. Or maybe, we work with the county veteran office, right? So they connect to other resources and benefits they're entitled to. Or, the maybe before it even comes to us, like Rika at the VA, social worker, connects them to the SSVF program. Or maybe they seek affordable housing at the Wisconsin Veterans Village, another partner of ours, below market rate apartments. So there's a lot of great safety nets in place. And generally, from my perspective, I think myself included, veterans tend to seek out maybe connections from other veterans because of similar lived experiences and because there's that peer support element too. Because I'm more inclined to talk to a fellow veteran about, hey, I'm going through this, whereas someone that doesn't have that connection is harder to connect to. So I really do believe we have locally, at least in the Fox cities, we have a really good system of identifying and connecting, filling some of those gaps and helping that veteran family navigate around some of the resources they might be eligible for, and then try to do it as rapidly as possible.
All right, if I can
David?
chime in then. So the different resources that are out in the community, because frankly, homeless veterans are something I focus on the most. And I purposely went out and developed the relationships with my community partners so that if a veteran does present themselves as being homeless, we can do something more than just talk. So I have a list here and I'll just share it with you. This is in no particular order whatsoever. But here are the community resources. Some are going to be at the federal level, some are going to be at the state level, and then some are going to be at the local level. So we got all different tiers here. Fox Valley Veterans Council, that's one of them. Levin, Center for Veterans Issues, VA HUD-VASH, COTS, Pillars, Garsky's Veteran Services out of Green Bay, Veteran Outreach and Recovery Program, also known as VORP. Then we have the Veterans Village. When I meet with my counterparts at the CVSO level and we meet together and they go, David, what are you doing for the homeless veterans in your area? I'm afraid to say something because in this area here in the Fox Valley, we are resource rich. You get outside the Fox Valley and a lot of these counties have one or no options for homeless veterans. What I don't want them to do is pack them all on a bus and send them to Appleton. I don't want that. I don't need that many people to help. I've got my own to help. I don't mind sharing God's love with everybody, but there's a limit of what I can do here. But just so you know, we went out and established these relationships because it does take a community to solve this problem. And I can't do it alone.
I'd like to add too that, as Jonathan mentioned earlier, veterans are very resourceful. Whether it's, I live in my car and I'm okay with that, or I know how to pitch a tent and I can go live in the woods. That's not an issue. I'm not identifying myself as homeless, but as we all know, like spirits attract. So whether it's, a hat, a haircut, the way we walk, the way we talk, perhaps, a bump into someone, man, I'm homeless. Hey, I got 3 rooms. I'll let you stay at my house. So I think there's some of that going on too. I know that we had one individual move here that I was working with from, I think, another part of the state, Wisconsin Rapids. I think had a house fire, lost everything, but and he was a veteran. So theoretically, he could be classified, he should be classified as homeless. But he had a friend in the area said, hey, I'll go ahead and house you for the time being. So we've been finding him resources in the meantime. But I think I think veterans are just extremely resourceful. So whether, again, you get them reaching out to these organizations, social media should be helping, websites should be helping, those type of things. Again, the great networks we have established, but ultimately the veterans are going to be resourceful. They may want to stay under the bridge. Maybe that's their thing. Maybe they enjoy that. Or again, they have a friend in town, family in town, or they just happen to meet at a gas station, both going through the same thing. And they just rent one house together and don't say anything. So it's multiple factors, of course.
David, would you be willing to share that resource list?
Absolutely.
Thank you
I'd
so
love to
much.
share.
If you go to our website right now,
Yeah.
Allegheny.org/veterans, we've worked very hard on that website, and there are just a plethora of resources, forms, how-tos, where to go. So that is already out there. I don't know if I have all of those on there, but there's even organizations that like HUA that take veterans skydiving. So again, there's these great networks of organizations where people just naturally tend to hang out, whether it's at the gym with CrossFit or sporting events or hunting. People again come together with like-minded issues and they wind up helping each other. That's what we do. So again, we may not be seeing those high numbers because frankly, they may be getting at the peer-to-peer level, they may be getting the help they need. We just don't know about it.
Hi, everyone. This is Donna with the Appleton Housing Authority. Just kind of want to chime on as one of those resources for the HUD-VASH program. We have openings. We have vouchers to use. Right now, I probably have 5 people with open vouchers trying to look for apartments, and they're just hard to find, hard to get them to use the vouchers. So if you know of anyone who is homeless, a veteran who is homeless or near homelessness, please contact me so we can maybe get them a voucher and find them a place to stay.
Donna, this is Lisa Strandberg from Pillars. Is it also fair to say that if anyone on this call knows a landlord who might be motivated to house a veteran, that they should also reach out to you?
Yes. And actually with the HUD-VASH program, it works a little bit different than Section 8. I'm not sure if everyone's really familiar with the vouchers in general, but with a voucher, a person pays according to their income. They pay a portion, and then we will help with the other portion of the rent. So I lost my train of thought where I was going with that. So for landlords, with the HUD-VASH program, they have a little bit of different policies with that. Generally, lots of times landlords with a Section 8 voucher program, they have to enter into a contract for a 12-month lease with a person. With the HUD-VASH vouchers, we have a little bit of a leeway there. Sometimes actually I just used a voucher for a veteran that a landlord says, yeah, I'll give him a try, but so he's on a month-to-month, start at month-to-month. So those VASH vouchers, we have different regulations or policies that really we can bend to get them housed, to give them a try. If landlords are denying them because of a previous eviction or whatever the case may be, bad credit or what that. So if the landlords are willing to give them a try, we can work with that also. That makes sense.
Thank you, Donna. I know that's very helpful since a lot of the people on the call don't necessarily work day to day with housing, to explain what some of these programs and acronyms mean, because there are a lot of acronyms involved with housing. So thank you for taking the time to do that. So we're getting close to the end here. So I want to just open it up to anybody, any final questions that you have? I have a lot more, but.
Hi, this is Lisa from Catholic Charities. Can you hear me okay? Yeah, thanks. So I jumped on today. My goal was to learn more about what services are there for veterans. I do intake and referral here in Green Bay. But we cover many counties, including Outagamie. It's our whole diocese, so there's 16 counties. Um, Recently, I've had an influx of veterans calling me saying everybody's out of money. There's nobody to help me. So these resources, thank you for everyone who posted those in there. That will help me to help them. Because I'm not really sure where to direct them, if you know what I mean, because when I type in VA, I can find HUD-VASH and I can find the Veterans Center, what is it, VCI or VCI, I think it's called. Okay, yeah. So I find a couple basic ones, but I think like today I'm learning there's so much more out there that I'm neglecting to give to them because I'm not aware. Just a couple comments, if I may, and I'll try to be quick because I know we're running to the end of the time. As far as the draft, I wanted to kind of piggyback on what the guys were talking about. So the Resch Center was designed with specifications for the draft. This has been a long time coming. I think there's also a whole lot behind, I was on a jury last fall. One of the developers in Green Bay was on the jury with me. And so I learned kind of a lot of things about intentions and plans, and they want very much for the homeless to kind of disappear during that time. They do not want, I think that's part of what that, when they were trying to criminalize homelessness and trying to pass that bill, just devastating. It didn't go through, but the idea is to get encampments, set up, so that they can be put somewhere so nobody can see them, veterans included, which destroys me. I cannot believe that, but it is what it is. We all know that it's just the way it is. So anyway, that didn't go through, but the mindset is there. I saw on Facebook Marketplace, someone is renting their house out for $75,000 for the week of the draft. I mean, you pay off a mortgage possibly. Like, that's just crazy. That's how big of a deal the draft is. So we've already started having preliminary discussions about how we're going to approach our job differently next year, because it's a very real deal. And I don't think it's just hotels and houses for rent in this area. I think it's this whole section of the state. It's a really big deal. So we are kind of working, we don't have a housing program here. I think Madison does, probably Milwaukee. Green Bay doesn't, but we are considering this and preparing to how we can do more when that time comes, because I think it's going to be a big, big deal. And our homeless, especially our vets, really go through enough. And just lastly, I'm sorry for talking so long, but I'm very motivated by this and very passionate about it. The vets that have called me, sometimes they talk. I have to kind of give them a little bit of space and kind of prompt to get them to open up. But they are the most humble people. I work with tons of people going through all kinds of things. And they're, like all the guys have said, they will, when it comes down to it, and I'm limited to what I offer them. Every single one is like, oh, it's okay. Thanks anyway. I appreciate you just listening. I appreciate what help you can give me. I have a lot of people who are very entitled, who call and demand things, yell and scream at me. I've never once had a veteran do that. So anyway, sorry to talk so long.
Thank you for sharing, Lisa. It is a really complex issue. I thank everyone who spoke today for giving us a little bit further insight into this issue. I wish we had more time to just dig in a little deeper. I do want to point out just a few things coming up at Pillars before we sign off. We are currently running our Independence Day match. Up to $50,000 for every donation could be matched by an anonymous donor. That is through July 4th. We do have our next Conversations Coffee coming up on the first Thursday in August. So that will be on August 1st. And It is Keys to Hope season. Save the date, October 17th, at the Bridgewood Hotel in Mina. If you would like to join us for our fundraiser gala that evening. We will follow up with some of the resources like we promised. Stay tuned. I will send an email out once we get this recording up, in case you want to review it, as well as some links to the other resources will be in there. On the screen right now, you should be able to see all of the different ways that you can connect with Pillars, and we really do hope that you would connect with us. I know many of you guys already are. So it is 8:30. I'm going to have to say, just respect everyone's time. If you need to sign off, sign off. I know that some people have commitments right after this. So thank you for joining us today, and thank you for being a part of this. If you still need to talk, we'll stay on for a couple more minutes, but I know that some of our presenters do need to go as well.
Thank you.
Thank you.
Thanks, everyone.
Thanks, Pillars. Appreciate you guys and your whole team and our collaboration over the years and ongoing. So thank you so much for all your help and everyone on this call that's helping our community and our veterans.
Yeah,
Thanks,
thank you
John.
for being willing to come and talk about them today. I really appreciate that.